Hello, this is Dr. Sandra Cabot. Welcome to my video on gallbladder problems. And if you have a gallbladder problem, or if you have lost your gallbladder and are still having problems, then my video series will be of great assistance to you. I've been a medical doctor for nearly 50 years, and I graduated with honours in medicine and surgery from the University of Adelaide, South Australia in 1975. This video is very important, and it's going to look at supplements that can help your gallbladder and improve bile production. There are different supplements that you can take to improve the function of your liver, gallbladder, and the health of your bile ducts. These supplements may also reduce the size and number of gallstones and reduce symptoms. They may help you to keep your gallbladder. However, it is always important to see your doctor if you have symptoms recur, and also to have regular checkups. Your liver makes all the bile, so you need a healthy liver to make healthy bile. Healthy bile, which is the correct composition, will keep your gallbladder and bile ducts healthy. This is important even if you have lost your gallbladder, as stones can form inside the liver and bile ducts after the gallbladder is surgically removed. One very effective thing you can do is to take a liver formula that has been clinically tested. Livatone Plus has been clinically tested and was designed by a team of medical doctors and naturopaths for a specific purpose. That purpose was to support the 2 detoxification pathways in the liver, as well as to reduce liver damage. Toxins that are broken down in the liver and heavy metals are excreted in the bile. Livatone Plus contains the clinically proven dose of the liver herb, milk thistle, also known as St. Mary's thistle, all the B vitamins, including activated B vitamins, the minerals selenium and zinc, antioxidants and vitamin C, taurine, glutathione and NAC. All these ingredients are combined in one capsule of Livatone Plus, and importantly in the correct amounts. Doses of Livatone Plus required vary from 2 to 4 capsules daily. Another formula that can be helpful is Livatone Liver and Gallbladder Cleanse and Support Formula, which contains the liver tonic herbs milk thistle, dandelion and artichoke, vegetable powders and a good dose of taurine. It can be used with Livatone Plus, or you can alternate these 2 liver formulas. You can see a video of Livatone Liver and Gallbladder Cleanse here. NAC, known as N-acetylcysteine, is most beneficial for people who have been exposed to toxic chemicals, or have had adverse drug reactions, or have chronic infections. Some people with gallbladder problems have chronic infection in the gallbladder and or bile ducts, and NAC may help to fight this chronic infection. NAC has also been used with success in people with liver disease, sinus infections and lung problems. NAC breaks down the mucus or biofilm in the gallbladder and bile ducts that bacteria hide behind. A clinical trial published in the Journal of Hepatic, Biliary and Pancreatic Surgery found that NAC can be used as a new agent for the direct dissolving of most types of gallstones in patients with gallstones. No side effects from NAC were observed either during or after the treatment. NAC is best taken orally with a whole glass of water away from food. NAC has been extensively studied in clinical trials, and when given intravenously, it is powerful enough to stop liver failure from acetaminophen, also paracetamol overdose. But it is important to take the NAC with a whole glass of water, as it can be sensitive to the stomach. The benefits of Livatone Plus and NAC can be truly life-changing. See some of our testimonials at liverdoctor.com. If you are vegan, you can take a taurine supplement because vegan diets are low in taurine. Taurine is an amino acid essential for bile production and may help increase your natural bile supply. Taurine is a component of Livatone Plus and Livatone Cleanse and Gallbladder Cleanse and support formula, but vegans may need more taurine than this. Ox bile supplements. Bile salts are normally stored in your gallbladder, and after your gallbladder is removed, it can lead to a bile salt deficiency. Also, a poorly functioning gallbladder or liver disease or bile duct disease can lead to bile salt deficiency. People with bile salt deficiency may benefit from taking bile salt supplements. It is also very important to stay well hydrated, since around 90% of bile is made up of water. There are no laboratory tests that can tell you if you are low in bile, but you may have these symptoms of bile deficiency. Click the link to see the symptoms. A trial of adding ox bile supplements is most worthwhile. Ox bile is best taken with meals that contain fat and in the middle of the meal. Ox bile supplements closely resemble the natural bile that your liver makes. Ox bile dosage required can vary from 125 milligrams to 500 milligrams per meal, so you may need to experiment a little. A dose of 500 milligrams can sometimes be too much for sensitive people, so you can begin with a dose of 125 milligrams and build your way up to the dose that gives you best results. Remember to take ox bile in the middle of meals. Use of bile salt supplements such as ox bile capsules during weight loss may also reduce the chance of gallstone formation. If you experience any of the symptoms of a bile salt deficiency, it is important that you see your doctor to discuss treatment. Medicines can be prescribed to dissolve gallstones. Ursodiol, also known as Urso capsules and tablets, are used to dissolve gallstones in people who do not need to have their gallbladders removed, or in those in whom surgery would be too risky. Urso works only for gallstones made of cholesterol, and works best when these stones are small and are floating in type. Urso will not dissolve calcified gallstones. Urso is sometimes used to help prevent gallstones in patients who are on rapid weight loss programs. Urso is also used to treat primary biliary cirrhosis, where the bile ducts are injured and scarred. Urso consists of urso deoxycholic acid and is one of the bile acids found in bear bile. Thankfully for bears, Urso has been produced synthetically by drug companies since the 1950s. Urso changes the composition of bile in a beneficial way. It can be effective for smaller stones and is relatively safe to take long term. You may also have to take Urso for several months or longer to treat gallstones. Some gallstones may not completely dissolve with Urso, and you may develop new gallstones within 5 years after treatment if you do not follow a holistic program. NAC is an alternative to Urso and has been proven to reduce gallstones. Let's talk about bile acid malabsorption, abbreviated to BAM. Bile acid malabsorption is a common cause of chronic diarrhea and is usually caused by reduced reabsorption of bile salts from the small intestine. Normally, bile salts are reabsorbed from the intestine to go back to the liver via the blood vessels known as the portal veins. If this does not occur, the bile builds up in the intestines and causes diarrhea. Bile acid malabsorption can occur in diseases of the small bowel and after surgery on the small bowel. Treatment of bile acid malabsorption is effective, and 70 to 96% of patients with chronic diarrhea caused by BAM respond to a short course of the drug cholestyramine. Adverse side effects can occur, but are not serious and may include constipation, nausea, flatulence, bloating, and abdominal pain. Let's talk about the gallbladder flush. The so-called liver and gallbladder flush has been around for a long time, and there are many different varieties of this flush. Most flush programs involve the ingestion of a combination of large amounts of olive oil, Epsom salts, apple juice, and citrus. These ingredients promote strong contractions of the gallbladder with the aim of expelling any gallstones. The gallbladder flush is often combined with self-administered coffee enemas or colonic irrigation from a therapist. There are some good testimonials and case histories for the gallbladder flush on the internet. My opinion is that these flushes may work for sludge and very tiny stones in the gallbladder, but talk to your own doctor first, as every case is different. I do not think these flushes are safe for those with medium to large sized gallstones, as the stones could get stuck on their way out, resulting in obstruction in the cystic duct or other bile ducts, and this may require surgical intervention. Some people will feel abdominal discomfort or pain and become nauseated during this somewhat unpleasant flush. Diarrhea during the flush is common. The gallbladder flush is not for the faint-hearted. Often gallstones are silent and cause no symptoms and do not require any treatment. In my opinion, it is safer to slowly dissolve these types of stones with a better diet, raw juices, and supplements. NAC is proven to dissolve gallstones. So I hope you've enjoyed this video, and if you have any questions, please email us. We'd love to hear from you. And if you want more information, watch more of our videos on the gallbladder. And if you enjoyed the video, please hit like and subscribe. And thanks for listening.